Hello. Whoa, we are really bright. Sorry, my head is so blinding. Hello, everyone. I wonder if I can see this a little bit. Okay. Hello, everyone. I thought I would start this little live. Oh, there we go. That's better. Just going bald right now. We are doing another live in the middle of the night because that is how I function. I have talked about this before. I am a night owl. Seems to be better when my hands are up, but I'm not going to stay here with my hands up the whole time. I wonder if I put my scarf on, if that will make a difference. This is my favorite chemo scarf, right? That actually helps. My face is too blinding. It's still blinding. I wish there was a way to fix that. Let me try turning it away a little bit. Is that better? Why does it have to be so blinding? There we go. Okay. Still looking blinding. Sorry, guys. This is what we get with live, is it's like, there. That seems better. I'm going to take this back off again because I am making a point. I wanted to get very real about what is going on in the world right now. Because in the past, I have not really talked about extraordinarily controversial things on YouTube. But I've gotten to a point in my life where I'm just over that now. Like, if something needs to be said, I'm going to say it. Like, I feel like I am secure enough in my beliefs now that I don't need other people's approval, and I don't need, like, anything other than, my sense of self-worth in God, than to worry about what everybody else is going to think of me for having my opinions about things. And I will state that it's partially my opinion, but my opinion is based on a lot of scientific facts. And let's see. Hello, Ali. Did you see the beaches and parties, 4th of July? Young people don't care about older people. Yes. And that is what I am here to talk about, because I have honestly been appalled at the behavior that I have been seeing from people in the United States, especially. But first, before we talk about that, in case this video, if other people are finding my channel who don't know me, my name is Amanda. I am currently undergoing chemotherapy. As you can tell, I am 36 years old and I was diagnosed with breast cancer at age 35. I have 3 young children. I have a 7-year-old, a 5-year-old, and a 2.5-year-old. And I am one of these people who am currently, right now, obviously at very, very high risk if I contract COVID-19. And the stakes are high. There's no other way around that. I am a mother of 3 young children, and they depend very much on me. I, do everything, like, keeping the family together, cohesive planning. Like, you moms know what moms do. And we all know what happens when a mom is not there anymore. And it is devastating. And that is a very real possibility if I were to contract COVID-19. Like, because my immune system gets so compromised by doing chemo, I am highly at risk of getting severe complications from COVID-19 if I were to contract it. And that is a very real risk. And I am not an old person. And that's what, this is the thing that like seems to be such a misconception. And it's starting to change now too. Like that at first it was more old people who were contracting the virus, or having the more complications from contracting the virus. That's starting to change, and people don't realize that. The number of people with moderate to severe symptoms who are getting diagnosed I just saw this report, between the ages of 22 and 44 are skyrocketing right now. And this is young, healthy people who may or may not have underlying health conditions, and they are getting hospitalized. They are getting put in the ICU as well. Yes, people who are like me, who have compromised immune systems and who are elderly with conditions and things like that, yes, they're at even higher risk from complications. But that doesn't mean that you are not, just because you are young and healthy. Um, all you have to do is just go on YouTube and listen to people's stories of who have had it. And, this isn't just some like bad flu. I've heard that one so many times, and I just want to rip my non existent hair out because seriously, um, in the United States, in all of 1 year last year, there were 80,000 cases of, 80,000 deaths from the flu. In 4 months, we reached 100,000 deaths in the United States from COVID-19 in 4 months, compared to 80,000, which is less, in an entire year from the flu. So this is not a bad flu. There's a reason that the entire world is taking this so seriously, because it is a legitimate pandemic. The flu is not a pandemic. It happens every year, and we have a vaccine for it, which is another issue that I won't go into today. But it is a very serious, serious illness, more serious than anything that we have had in living memory. The last time that we had a legitimate pandemic was in 1918, the Spanish flu, which, by the way, did not actually start in Spain. I've watched a couple of documentaries on it, and I guess it was Spain where they were actually taking more precautions than a lot of other places. And they got a reputation, and somehow it was named the Spanish flu, but they were actually doing better than everyone else in terms of preventing serious illness in their people. But that's another thing. So we have not experienced a legitimate pandemic like we are right now since 1918, with the flu, severe flu that they had. And I guess it was some variation of H1N1 that was extremely deadly. Like really not pretty death. People like bleeding internally and dying, especially the second round of the flu that came around was like twice as deadly than the first wave that came through. And with the second wave, it was so severe in some people that they could contract it, and then, in the morning and 12 hours later, they would be dead. So it was definitely more deadly than the one we have now. How quickly it killed people and how many people it killed was more, but this is still more than any sort of normal thing that we have that comes around yearly. So it's a very serious illness, and I am just so dismayed at how many people are not taking it seriously, especially young people. They think that the rules don't apply to them, and they have these huge drunken parties, and with zero social distancing, no mask wearing, and then they take it home to grandma and grandma dies. So, like, I'm trying to decide on which thing I should talk about next because I have so many things that I want to talk about. Um, I think the reason why this is so much worse in the United States, it's also bad in places like Brazil, where they have had a very similar mentality as the United States and a very similar leader as the United States right now. Um, it's this um, what I am calling toxic individuality. American culture is very um, prideful about their individualism. And don't get me wrong, there are some huge advantages of individualism. Like, I think we've had a lot of innovation and creativity and things like that from people who refused to fit the mold and really went their own way and um, really used the individuality for the best possible outcomes. So there really is an advantage and good side to individuality, but there's also this toxic side, and it has never been more apparent than it is right now in the United States, and that is what is making our rates skyrocket right now. Because people think, oh, it doesn't affect me personally. If it's not a problem for me, it's not a problem. And that mentality is so toxic. We have lost the collectivism and this idea of love thy neighbor. I am a person of faith, so that is incredibly important to me. And what it baffles me is that there are so many people who claim faith who are saying that, who are like refusing to wear masks. And I'm just like, huh? What? I'm so confused because what happened to love thy neighbor as thyself? Like, the most basic commandments: love thy neighbor and love God. So when we are not wearing masks, when we are not social distancing, we are not loving thy neighbor, not even close. We are basically giving the middle finger to thy neighbor because people are only thinking about themselves. They're thinking about me, 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 me. This doesn't affect me, therefore I don't need to care. I'm young and healthy, so I don't need to care, which you know, in fact, is not actually the case because you can be affected too. What happened to, like, I feel like we had this golden opportunity, and I was actually feeling kind of hopeful about this when this first came out in late February when I first got my cancer diagnosis. Which, by the way, if you're new here and you want to know my cancer story, I have a whole playlist on it. I will put it after I'm done here. I will put it in the cards here, or wherever one of those corners. Um, but we had this golden opportunity to do like people did in, like World War II, when everyone had this opportunity to come together and have this sense of cohesiveness and unity, that, look, we are having this global crisis and we have this golden opportunity to come together and do the right thing and care for each other. And I was kind of hopeful, like, maybe this will be the thing that will help Americans get over their toxic individuality. This doesn't have to be socialism here. This is just caring for your community. And it's so easy to do. Like, I mean, yes, this is not easy. You have to make personal sacrifices to take these precautions. hard when you can't see your friends. Nelly, you are hitting the nail on the head. Thank you. I'm glad to know that there are other people who agree with this because I had to say something because it is just blowing my mind. um, so I'm like, maybe this is the like one thing that is going to cure us of our toxic individualism, and we can come together as a country, as people, and really show care to each other and get through this, do what we needed to do to get through this. And the opposite happened. And when that happened, I was just like, what? Like, we had this golden opportunity and we just let it slip away. And it's not too late. And I really hope that people can see the light, so to speak, and realize what's going on here, because all we have to do is look at all of the other industrialized nations in the world, and they have that sense of community. They have that sense of caring for their neighbors, and they're doing that. I mean, you look at Canada, you look at most of the European countries, you look at New Zealand and Australia, Taiwan, all these other countries that have this sense of we over me. And that's really working out for them. And that's really what we are missing here, because they are now, when they had their lockdowns, people listened and they followed the health guidelines. They didn't think that this was some ridiculous conspiracy theory, because it's not. The virus does not care about your political positions. I don't care what your political positions are. I don't care what your religious positions are. All those things, the virus does not care. The virus just wants, if you have lungs, that's all the virus cares about. It wants to infect you, and it will. Just because you think that it's not real does not mean that it's not real. It's real. All you have to do is ask my healthcare friends, any healthcare people. I have a number of friends in the healthcare field, a couple of which are even working in the ICUs. I hear these ridiculous arguments, oh, well, numbers are being overblown, blah, blah, blah. Healthcare workers don't think that. They are the ones who are actually seeing day to day what is happening. They see patients dying without their family members around them. And I hear these ridiculous, like, oh my gosh, don't even get me started on the stupid pandemic documentary that was going around. I don't care what your opinions are, if you know my opinion about that. The whole pandemic thing was done by a person who was shamed by the entire medical community and shunned by the entire medical community because she had done some illegal things. So let's start with that. There's this whole conspiracy mentality that is so toxic, and it is hurting our communities. It is hurting our country. And I'm like not afraid to say that publicly now, like, because I am seeing firsthand the damage that is, that kind of mentality is doing. And it is damaging. There is no way around it. It is damaging. This, thinking that, because I read a mom blog, or because I read this, one doctor who was shunned by the medical community, like, I know better than the entire medical community. All doctors, the vast majority of doctors around the world, the CDC, the WHO, all of the different countries, like, if this was a conspiracy, like, they're doing one hell of a job getting the entire world to go along with it. Oh my gosh. Um, I don't get worked up about a lot of things, but this one I really am, because it is important and it is affecting every single human being in the entire world right now. And it is a risk to every single one of us or somebody that we love. So if that is something that, you have friends sharing that kind of stuff, please speak up, because um, I used to have this mentality of live and let live, like people can believe their different things and that's fine. And I generally think that that's true, except when there are harmful things being shared that are hurting people and hurting the community. Then it's important to speak up in a kind and loving way. And I have been actively trying to do that myself. Um, so anyway, there's that topic. And then I hear just these other things of like, oh, well, when there's more testing, there's going to be more cases. Well, yes. um, yes and no. Hello, Kristen. COVID sucks. And sadly, when I thought my friends had COVID-19. Oh, she lied about having COVID-19. Oh, I am so sorry. Oh, I have a friend right now who is a nurse in a local hospital, and she had a patient come in who lied about having a positive test and came in and infected like the entire floor of people in their hospital. And I'm like, really? Don't lie about that. Oh, Lord. Anyway, so what I was going to say about the numbers. People are saying like, well, more testing, there's going to be more cases. Yes and no. Like, yes, it's telling you what reality is. I saw this meme that showed this pregnant woman that was like, if only I hadn't taken that test, there would, and I'm like, that it perfectly describes the absurdity of that argument. Or like, if I never stepped on the scale, if people never stepped on the scale, they would never gain weight. So, like, having a diagnostic does not mean that it's not a problem. Doesn't mean that it's not real. If you are pregnant, you are pregnant, regardless of whether you take a pregnancy test. If you have gained weight, you have gained weight, regardless of whether you step on the scale. If there are increased COVID cases, there are increased COVID cases, regardless of whether they are tested or not. And the thing is, these other individualized countries where they have more testing than we have here in Canada and Europe, these kinds of things, they have more testing and they have fewer positive cases because everybody is caring for everybody. Excuse me. Everybody's caring for everyone else and following the precautions and taking the health authorities seriously. Like they are doing their social distancing. They locked down for as long as they were asked to, not because this is oppression, but because this is about stopping death. Stopping unnecessary death from people dying. And they did, they listened. And now they slowly open things up. And in doing so, everyone wore masks. They did not make masks a political thing in these countries. And so therefore the people don't view it as a political thing. They just view it as this is how I'm protecting my community. And that's what they're doing. And now they are enjoying really low rates and they are able to open their economies now because they listened and to the health authorities. They didn't think it was some ridiculous conspiracy, and they cooperated, because that's what you do. Like, the health authorities are there to help protect the people. They're not here to try and control the people. It's just, oh, it drives me mad. um, and guess what? Like, places like New Zealand did that and they completely eradicated it. So now, I mean, they still have a few cases coming in. They're allowing citizens to come home if they've been overseas, and those people have to quarantine for 15 or for 14 days, and they get payment from the government for doing so, for the inconvenience of lost employment, things like that, which, don't even get me started on that, on how we could be supporting people financially, economically through this, which we are not, which also makes this another kettle of fish. But so it's like, these things work. They work. Like, you just have to look at these other countries, and it worked. And so with the testing, yes, we are testing, and yes, we have higher cases, not because we're testing, but because nobody listened to, not nobody, that's not true. I need to give credit where credit is due. There are a lot of people who are taking this seriously. And to you, thank you. Thank you. Thank you. Please keep doing what you're doing. Fight the good fight. Help other people in your life to do the right thing as well. But there are those who are not, and who are spreading these toxic ideas, dangerous ideas, like literally dangerous. People are losing their lives because of people's unwillingness to cooperate with these precautions. People are losing their lives. Now, let's talk about masks for a second, because I think sometimes people are legitimately confused about how a mask actually helps protect. First of all, this is backed by many studies now, internationally, many countries. All of their studies, they've all corroborated their findings now, and they all agree masks are effective at slowing, not completely stopping, but we're going for slowing here, slowing significantly the cases of COVID and the spread of COVID. The way it works, yes, even cloth masks, because I hear people say, oh, well, the size of the virus is so much smaller, it can just fit through the holes of a cloth mask. Okay, so a virus, let me explain this, because I have had people like legit ask me who are curious, like not because they're trying to argue about it, but they're curious how it works. So in case you were wondering how it works, I will explain it. I've been reading all the science on this. So the virus has to travel on respiratory droplets and aerosols. So yes, the virus could fit through the little holes in your mask or whatever, but it's not going to, because it has to travel on the droplet. It's like not just the virus by itself going through. It has to go through, or it has to, ride on a droplet. And cloth masks do capture those droplets and aerosols and prevent them from going into the air. And the reason that everyone needs to wear one when in public places is because, especially the most recent study they found, is that COVID is airborne, meaning it lingers in the air. What I had first heard was that droplets stay in the air, like suspended in the air for up to 10 minutes, and that aerosols up to 3 hours. But now I'm hearing even up to a day or two. So those little microscopic droplets with little viruses sitting on there, they're just like sitting there waiting to go into somebody's lungs. They sit there in the air for up to a couple days. So if somebody who is asymptomatic, this is the thing that people don't understand. Kristen says, Mom's sadly not supporting me. Oh, I'm so sorry. Oh, geez. Yeah, what kind of person lies? It's ridiculous. It really is. I agree with that. That really tells you more about that person's character than yours. Anyway, so the droplets, so they're sitting there in the air. So if somebody who is an asymptomatic carrier, this is the thing that people are having a hard time grasping, asymptomatic or pre-symptomatic. So that means you have contracted the illness, but you are not having any symptoms yet, but you might in a few days. But you are still breathing your COVID-y air into the public places that you're going. And it's sitting there suspended in the air, waiting to be breathed in by someone else. This is why it spreads like wildfire, because it is airborne. So this is why why they're doing mask mandates and everything. They are in our state in Washington, which I am so thankful for. It's because it keeps your breath to yourself. It keeps those respiratory droplets and aerosols to yourself, like up to like 97% or something like that. So it's not perfect, but still, we'll take that over nothing, right? And this is the thing, this is why we need to test also, not only sick people, but healthy people, because we're realizing just how rampant asymptomatic spread is. And that's why it's also spreading like wildfire. And then you get people refusing to wear masks. And I read this one study they did where they contact traced one person who rode an elevator and infected 72 other people just by breathing in that elevator. And her droplets were then in the elevator, and a few other people got into the elevator, contracted it, and then spread it to all the people they know. So, which ultimately ended up being 72 people, 70 people, can't remember, something like that. So this is why we wear masks, because it legit, not completely, but almost completely stops asymptomatic and pre-symptomatic carriers from spreading their COVID-y breath and making it go airborne where other people can breathe it. So that is the science behind it. So it is not about protecting yourself, although it does have a slight protective, it is slightly protective for the wearer as well, but it is mostly about keeping the wearer's breath to themselves. And so this is about caring about everybody else around you. Once again, this is the toxic individuality problem. This is not about me. This is about everyone around me and protecting everyone around me. And this is what is so important for everyone to understand. Like, we have to stop thinking about ourselves. Like, another good description that I heard for the problem with the United States right now is collective narcissism. And that, people think like, I'm only going to care about me and mine, and it is not my responsibility to make sure you stay safe. I've actually had people tell that to my face, or in conversation, like social media conversations before. They say, it's not my responsibility to protect you. And I'm like, gee, thanks. First of all, I have a really thick skin. So once again, I know that says more about that person than it does about me. But really, that mentality is so toxic. Like, you don't know who you are protecting by wearing a mask and by social distancing and by following these precautions. You don't know who you are protecting. I've had people say, you need to protect yourself. You're going through chemotherapy. You need to protect yourself. I'm like, do you really think I'm not protecting myself? Because I've had multiple people tell me that. I'm like, do you really think I am not protecting myself? Like, I don't go into public right now. I have friends doing errands for me. I am very, very fortunate that I have the most amazing village who is helping to care for me right now. My husband, for his work, has to do occasional errands, but he wears an N95 mask when he goes in. And my mother-in-law occasionally does errands for us, and she also wears an N95 mask, but she's also in her 70s. So this is also for protecting her. Before I did treatment, when I went into the store, I also wore an N95 mask because I'm doing both. I am protecting me and I am protecting the people around me. This is not an all or nothing thing. I talked about this in my video that I made the other day about family vloggers. All or nothing thinking, like black and white thinking. It's this or that. And that's also toxic. Like, we really need to be able to think in shades of gray and nuance. I can't reiterate that enough. Like, the world is a world of nuance. This is about protecting yourself and everyone around you. We can do both here. If you are a person of risk, yes, take the extra precautions like I am. But the thing is, not everyone who is at a higher risk of complications from COVID has the luxury of being able to have, a village do all of their errands for them like I do. I am really, really fortunate that I have that village, but not everyone in my position does. Not everybody has family that they are close to or who lives nearby. Not everyone has that kind of community. And so therefore some people who are at higher risk are have no choice but to go get their groceries at the store. There are economically disadvantaged people who have no other choice but then to run their errands. There are moms who are on a WIC or things like that. Like, they have to go to the store because you can't buy your groceries online with WIC, like, for example, elderly people. And the thing is, like, there are more people at risk than you even realize. Do you know somebody with asthma? Anyone with a heart condition? Do you know somebody, with some sort of lung condition? Do you know somebody who is immunocompromised in any way? There's a lot of people who are at risk of serious complications from COVID. And it's a lot more people than you realize. So when you are going to a public place, you don't know who you are protecting. So by wearing a mask, you could be literally saving someone's life. I can't reiterate that enough. Just think about, if you were in that position, wouldn't you want someone to help protect you and your life? I know, being someone in that position, I certainly appreciate the people who are doing that. So anyway, I'm trying to think if there was anything else. Did you guys have any other questions or ideas here? That was the other thing that I wanted to say was just the science behind all this, because I think people don't realize. I hear people getting like upset that, oh, they're saying it was a COVID death when it was actually a heart attack or like whatever reason. Okay, once again, nuanced thinking. The body is really complicated. I can link some videos from a legitimate doctor who explains the science behind this in very technical terms. Like, I couldn't even fully grasp my head around everything he was saying because, like, he knows his stuff. Inflammation is actually what's killing people from this disease more than anything else. They have what's called a cytokine storm, where the virus is causing the body to have an immune response, inflammation response that is so severe that it is that response that is killing people. So that's why they are starting to find that things like dexamethasone, which I actually happen to be taking along with my chemo, which is a steroid, which reduces that inflammatory response, is saving people's lives. So if somebody comes in with heart disease and then they get COVID, so they already have weakened blood vessels, and then they have this immune attack of their blood vessels because they're realizing just how much blood vessels are involved in this. And they get into the blood vessels via the little alveoli in the lungs, which is where it enters in. Um, so yes, sometimes there is a cause of death that is more that's not just COVID and it's not just a heart attack. Maybe COVID caused the heart attack or whatever the case may be. Um, People need to think in more nuanced, be more nuanced thinkers than that, because yes, these do count as COVID deaths. If yes, maybe they had a heart attack or a stroke or whatever the case may be, but it was COVID leading up to the inflammation in the body that made it so that they couldn't survive that, you know? Anyway, so that's just my little rant about that. So, my message here, geez, I've already been talking for 40 minutes, so I better close this up. But my message is think about we over me. Like it's really the mentality that needs to shift in our country right now in the United States. That is the only thing that is going to get us over this and stop the wildfire spread of it. And like, if people want to open the economy, if people want to open the schools, we have to take the precautions necessary to do that so that people don't die in the process. This is not fear mongering. This is not blowing things out of proportion. This is looking at legitimately what is happening in people's real lives. People are dying, and we need to consider that when we go out and be reasonable about it. Like, they know that it doesn't spread in, outside air where there's a breeze and sunlight, and unless you're in a very crowded, tight, close quarters with other distance from other people, you're most likely okay without a mask. But keep your distance. If you go, the biggest thing is public indoor places. Wear a mask and socially distance in public indoor places and keep moving. When you are going to the grocery store, get what you got to get and get out so that you are not lingering in there. These precautions are so easy. Wearing a mask is so easy. Oh, that's the last thing I was going to say is people say there are medical reasons why people can't wear masks. Yes, there are some medical reasons, but that's not the majority of people. The majority of people who are not wearing masks are not doing so because they think their freedom is being, crushed or whatever, which is not the case. I'm like, if you want to know what a real oppression is, go to North Korea. Like, if you want to know what real tyranny is, go to North Korea. Wearing a freaking mask is not tyranny. This is no more than wearing a seat belt when you are in the car. This is, people resisted seat belts when they first came out as well, and now people accept them. Like, it's the exact same kind of mentality. Wear a mask. It does, yes, it's uncomfortable. We all acknowledge that it's uncomfortable, but it's just for however long you're in the public place. You have to wear when you're at work. Yes, it's uncomfortable and for a long period of time, but you don't know who you are protecting. This pandemic is not going to last forever. No pandemic has ever lasted forever. This one's not going to either. We will get a vaccine. We will get some sort of effective treatment. And there are healthcare workers and researchers working tirelessly out there on this for the sake of saving lives. And so it's not going to be forever. So, put on your big boy pants and your big girl panties and wear the mask. Like, it's not hard. I just see how people have lost also just this sense of, like, there's so much whining. I'm like, if I can get through cancer treatment in the middle of a pandemic, like the discomfort of going through chemotherapy, you can wear a freaking mask for an hour at the store, So anyway, that is my message. Think about others. It's time to stop thinking about me, 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 me. It's time to start thinking about everyone else. And this isn't even just about me and my situation. Like, even if I did not have this situation, I would feel the exact same way. I have many people in my life who are at higher risk or at over 70, like my parents. Like, I care about people, and I don't want people to die unnecessarily. And you shouldn't either. So please, that is my message. Please do your part. And I think I'm going to close it there. Thank you guys so much for watching, and hopefully I will have comments on this video. Any sort of negative conspiratorial comments I will be deleting. If I don't have comments, I will post this onto my Facebook. I will also link it to my Instagram, and I will also link it to, let's see, I will also put it in my community tab. So anyway, stay safe, help everyone around you stay safe, do your part. I love you guys. Take care. Bye.